we've talked about what CPR is. We've looked at why CPR is useful. We've established that if the body cells and tissues does not receive oxygen within a short period of time, they could die. And if it continues for a long period of time, the individual might die. So now what does CPR do? What is the main purpose of CPR? The main purpose of CPR is to keep oxygenated blood. Please pay attention to that. Oxygenated. When we say oxygenated blood, that means a blood that has oxygen. Yes, there are some blood that do not have oxygen. They are called deoxygenated blood. Come, let me write it. So what CPR does is to keep oxygenated blood flowing through the body. Why must it be oxygenated blood? Don't forget that we mentioned that this cell, the body cells and tissue require oxygen. So if the blood is even getting there, but it is not oxygenated, it's still not useful to the body. It's still not useful to the cells because it will only contain maybe nutrients, but it's not going to contain the oxygen that will make them stay alive. So the main purpose of CPR is to keep oxygenated blood flowing through the body. It is when the blood flows through the body that it's able to get to the cells and the tissues, and to also keep. So once the oxygenated blood is flowing through the body, it will help keep the vital organs alive. Vital organs alive. So now I mentioned the word cardiopulmonary is made up of cardia and pulmonary, heart and lungs. Remember I mentioned that I said lungs is involved in respiration. So we're not just talking about blood coming from the heart. That blood must also be oxygenated. That blood must also be oxygenated. When we continue, we'll be looking at the different component of CPR. That will be tomorrow. The different component of CPR and which one deals with the heart, which one deals with the lungs. So by the time we continue tomorrow, we'll look at that. So now let's look at how to assess your patient and decide what to do. And I mentioned earlier that we'll be talking about how you are going to know if an individual needs CPR or not. Sometimes some people just faint. Those people don't need CPR if they faint. So how do you know if the person fainted or if the person heart has stopped beating? So now I'm looking at 4 points. 4 points. So the acronym Dr. AB. That's DRAB. Please, you have to follow the sequence. D first, then after DR, then after A, after A, B. Before you now decide, do I need to perform CPR or not? So this D stands for danger. So when you see an individual in a lifeless state, you have to first check, is that scene safe? Is that environment safe? Hope there is no hazard or any harmful material around. So you have to ensure that you remove every hazardous material you have around and ensure the safety of the patient and also the safety of yourself. So first check for danger. Is there any danger around? Is the scene safe? Hope we don't have any harmful or dangerous material around. So if we have any of such material, you have to take them away first. And please CPR is not something you waste time on. So you have to be very proactive and fast. So just take them away as soon as possible. So after you've cleared out any form of danger around, the next one is R, which stands for response. So after you've checked, there's nothing harmful, maybe there's no hot fire, there's no hot oil, there's no hot water around, there's nothing harmful around, then you now check, okay, fine. Is this patient going to respond if I try and call out his or her name? So you will attempt to wake the patient up. You either shout loudly into the patient's ear or shake the patient's body. Just shake the patient's body and see if there will be any response. So you have to check if there will be any response. It could have been that maybe the person fainted or the person was just tired and the person just fell on the floor. So you have to first check if there will be any response from the patient before you start anything at all. So if there is no response, that means the person is already unconscious. Is already unconscious. And once an individual is unconscious, the very first thing that happens is their airway becomes blocked. And once their airway is blocked, they won't be able to breathe in oxygen. And don't forget, oxygen is vital for the survival of organs, tissues, and cells. So the very first thing you do after you ascertain that person is unconscious is to first open the airway. So if there is no response, then the very next thing you have to do as soon as possible is to open the airway. So how do you open the airway? You will tilt the head backwards. Don't forget the patient must be lying down on his or her back. So you will tilt the head backwards and lift the shin, something like this. Let me clean this out. Explain. So look at this patient, and this patient is lying down, lying down. Then the head has been tilted backwards. That's why it's up. That's why it's up like this. Then you will lift the shin. You lift the shin up just to open the airway. It is actually very important that the airway stays open. Then after you've opened the airway, then you now check if the patient is breathing by placing your cheek above their mouth. So just put it on their mouth. Then check, look at the chest of the abdomen for any sign of breathing. Check, there's this way our abdomen goes in and out anytime our heart is beating and anytime we are breathing. So check if such movement is occurring. Then you can also put your ear close to their nose to check if they are breathing out at all. And please, this should be done within 10 seconds. Don't waste time. See, in CPR, there's no time to waste. You can't be slow. You have to do it very, very fast, because cardiac arrest is a condition that deals with time. The longer it takes, the slimmer the chances of the individual surviving. And please, if the patient is making some unusual sound, if the patient is snoring or an irregular breathing, so please ignore it. As long as the stomach is not, as long as the abdomen is not making those movements, and when you brought your hair close to the nose, there's no form of air coming out of the nose, so please ignore it. Once that is not happening, know the patient is not breathing. If the person is not making one noise, forget that does not count for normal breathing. So if the patient is not breathing, one, call for medical help. That is very important. If we have more than one, if you are not the only one there, tell the other person to call for medical help as soon as possible. Then you can start CPR. Call for medical help as soon as possible. Then you can start. And if you are the only one there, you can take your phone, call for medical help, put it on loudspeaker, be talking to them as you are performing the CPR. Remember, there is no time to waste. It is actually very, very important you call for medical help, because CPR is just to sustain the patient pending the time medical help would arise, because CPR does not restart the heart. Don't forget, the heart has stopped working. It has stopped beating. CPR does not restart the heart. It's just helping the heart to carry out its function manually. There is a machine that will be used to restart the heart. We'll talk about it very soon. So please don't continue CPR without calling for medical help. Call for medical help immediately, because yes, the person might recover before medical help arrives, but it's actually very important that the person still gets medical attention. And it's possible that the person will not even recover until medical help arrives. So please call for medical help and start CPR. I'm not supposed to put immediately, and start CPR immediately. There's no time to waste. So this is where we'll be stopping for today. Remember, I said we don't want to rush things. We want you all to understand well. So if you have any question, any comment, any clarification, I want you to send it in as soon as possible. Thank you.